I'm Dr. Linda Snetselaar, Editor-in-Chief of the Journal of the Academy of Nutrition and Dietetics. Welcome to our podcast today. We will be discussing concepts related to the journal commentary titled Comparing Food Security Before and During the COVID-19 Pandemic, Considerations when Choosing Measures. And today my guest is author of this particular commentary, Ana Poblacion, and she is a research scientist in the Department of Pediatrics, Boston Medical Center in Boston. So, Anna, thank you so much for being a part of our podcast today. And I will start with just a few questions.
Oh, thank you, Linda, for the invite.
Your article on considerations when selecting measures of food security and insecurity at the household level has great significance, I believe, today in terms of research in this area. What are some of the take-home messages from your article on this particular topic?
Before I respond to this important question, I would like to acknowledge my co-authors in this article, Dr. Stephanie Ettinger-Dacuba and Dr. John Cook, and thank them for their expertise and mentorship. If I may, I would start by defining food insecurity and then contextualizing the magnitude of food insecurity pre-pandemic so our audience understands the take-home messages. Is that okay?
Yes, that's a good
Great.
idea.
Well, the U.S. Department of Agriculture defines food insecurity as the lack of consistent access to enough healthy food for an active, healthy life due to financial constraints. And the United States measures food insecurity using the national gold standard called Household Food Security Survey Module, or HFSSM. Using this measure, the USDA has been tracking a trend in time, and food insecurity prevalence has been consistently over 10% for the past 25 years, reaching a level as high as 15% during the 2008 recession, and almost double this prevalence among Black and Latinx households. And then, which I hope leads us to rethink food insecurity as a chronic public health issue. So when the COVID-19 pandemic was declared a national emergency into 2020, researchers and policy experts knew that this situation would only exacerbate the already high prevalence of food insecurity. So in response, the research community made efforts to track the pandemic's influence on food insecurity across the country. But for the sake of expediency, many measures were created or adapted inadequately, which are likely to produce inaccurate reports of food insecurity that influence policies and resource allocation to mitigate food insecurity. So given all of that, I would say that the take-home messages are first, in order to mitigate food insecurity, we need to acknowledge that the pandemic only exacerbated the already high prevalence of food insecurity and hunger in the US. And second, to inform policymakers or healthcare and service providers or community leaders, we need to accurately share data points coming from validated measures that at least should carry properties such as validated dimensions or validated recall periods and validated wording in questions and responses. With these considerations in mind, we are able to accurately compare food insecurity before and during the pandemic.
Very, very, very helpful definitions. As we look at public health policy and the implementation of programs, what really makes the difference relative to measures in a food insecure population?
That is a great question. Thank you. I believe that to evaluate the success of health policy and program implementation, we need not only to accurately measure food insecurity using validated measures, but also that these data are comparable within a baseline. In the case of COVID-19 pandemic and food insecurity, for example, accurate data comparisons before, during, and whatever it may be after the pandemic will define how we evaluate success of interventions. And if we use different measures across time points and questions that are not previously validated, we run the risk of making misleading conclusions about who was hardest hit or who needs ongoing help, or if programs are actually making a difference in people's lives. Also, in a more macro level, data produced from non-validated surveys can also lead to harmful decisions about program funding and resource allocation and deployment. A classic example of this would be inaccurate conclusions informing the rollback or termination of COVID-related programs and benefits before people at the lower end of the income spectrum and most at risk for food insecurity have had a chance to recover themselves from the pandemic.
Okay, so that concept of apples to apples, as you were saying initially, is very important.
Definitely is.
So, how did COVID-19 impact the way researchers measure data collection related to food security?
To answer this question, I again would like to contextualize by sharing a little bit of history of the food security measure, the HFSSM that I mentioned before. When developed in the 90s, the HFSSM was validated to carry 4 domains, and they are anxiety or worry about the adequacy of food supply, quality of food intake, quantity of food intake, and social acceptability of the sources of food. Also, the HFSSM was developed to be a household level measure containing 10 questions in households with adults only, or 18 questions in households with children. And according to the number of affirmative answers, these households are classified in 4 levels as having high or marginal or low or very low food security. And that is over a period of 12 months or 30 days prior to the survey. So this is the HFSSM gold standard and should be the reference for all of other measures. Knowing that these facts give us the ability to understand that when measures were created or adapted during the pandemic, many measures didn't carry the gold standards metrics. For example, some measures changed question wording or used new questions that didn't carry the 4 dimensions of the gold standard, or changed response alternatives, for example, from often sometimes true or never true to yes or no, or changed the recall period to time frames other than the validated 12 months or 30 days. And last but not least, some results were reported as individual level data instead of household level data. Some of these changes that I have just mentioned have been previously studied and showed to significantly reduce the sensitivity of the measure. Also, these changes are likely to influence the food insecurity prevalence, comparability with pre-pandemic data, and evaluation of interventions. But to me, more importantly, if changes are to be made or new measures are to be developed, we need to name them differently than food security to avoid confusion when comparing data.
What are some of the conclusions that would be of value to persons doing research in this area, and how might those conclusions affect a clinical registered dietitian nutritionist in a practice setting?
Great question again. For those doing research, I would say that food security is a public health issue and needs our attention. And to better respond to food insecurity, we should use validated, well-established measures. And for those in community or clinical settings, I would say that I truly acknowledge that using the full HFSSM is probably impractical because of respondent burden or time constraints. However, other validated measures can be used instead. Currently, we have the shorter 6-item adult version available, the 9-item version for children ages 12 years and older, and a 2-item screen. The 2-item screen is called the Hunger Vital Sign, and it has been widely used to identify households at risk for food insecurity. Once identified, families can be connected to public food assistance programs, including SNAP, WEEK, CACFP, or school meals, summer food programs, and other programs. They can also be connected to the National Private Food Assistance Network. But most importantly, to prevent food insecurity, we need to recognize that this is fundamentally an income and wealth equity issue. And for that, we need national policies that help people of all backgrounds to achieve economic mobility and wealth accumulation. But Linda, maybe this is a subject for another commentary.
Yes, that would be wonderful. Thank you. So Anna, I just want to thank you so much for sharing this information with us. Your ideas have really shed new light on measuring data related to food security. And again, I so appreciate your messages for Academy members who might be working with people in food insecure households. Thank you.
Thank you, Linda, for the opportunity to discuss such important topic with your audience. Thank you.